Even though many people are confusing headaches with migraine, migraine is not just a headache, and migraine is not just migraine. Migraine attacks are much stronger and much more severe, accompanied by many different symptoms compared to the ordinary headache. Migraine is a complex and severe neurological disease. It is classified in many different types and subtypes. Let's look at the most common ones, and maybe you are able to find yourself in one of those migraine types. As I mentioned in the beginning, there's a disclaimer to be mentioned. Migraine is very individual. This means we are not trying to be exhaustive, naming all different migraine types and subtypes. Migraine is so individual that you might not find yourself within those most common ones that we are mentioning within this video. In total, there are 26 different migraine types and subtypes, and they all have in common that they can be distinguished between their symptoms, their frequency, and their severity. If we're trying to be in very broad categories, then we can distinguish migraine types and subtypes in two broad categories. There's a migraine without and with aura. A migraine without aura is characterized by a severe or moderate headache, usually on one side of the head, and the pain is described as pulsating, throbbing, or stabbing. And usually migraine patients are also, before, during, and after, more sensitive to light, and they might feel nauseous. A migraine attack might last between 3 hours and up to 4 days. While migraine without aura is more common, 1 in 3 migraine patients are experiencing migraine with aura. And it's quite difficult to describe the symptoms of an aura because there are plenty. Aura symptoms might differ. There are more than 25 different ones, but the most common ones are visual or sensory disturbances. So migraine patients might have a wavy view, or they might see flashes of light or blind spots. They might experience tingling or paralysis or disturbances of speech. Migraine aura lasts between 5 to 60 minutes and usually occurs before the actual migraine attack. Another way to distinguish migraine types is by frequency. So you can distinguish migraine between episodic and chronic migraine. And episodic and chronic migraine symptoms are the same, but the frequency of chronic migraines is more frequent. The definition of chronic migraine is to experience 15 headache days per month, 3 months in a row, and of those 15 headache days, you need to experience 8 days of those with migraine symptoms. And chronic migraine is not that uncommon. 3 to 5% of the overall population are actually experiencing chronic migraine. One of the top reasons why people are moving from episodic to chronic migraine is, for example, overuse of medication. Your migraine type influences your treatment pathway. That's why it's really important to keep track of your symptoms, the severity and the frequency of those, and of your medication. That way, your healthcare professional is able to individualize your treatment. Check out our other videos about other migraine types and migraine diaries.